I wanted to take 1 minute before I introduce our first speaker um, and talk about something maybe a little bit old in ALS therapy, but it's important because it shows how one learns from the speakers, but also from nurses such as Jumana and many of the other nurses. And this goes back some years when I was in the ALS clinic and a pastor brought in his wife who had ALS and had significant problems with weakness. Really, as a result, she looked a little bit unkempt. And I evaluated this patient. And my nurse at that time looked at the patient and said, I know what we could do for you, what you need. And I was thinking to myself, gee, what does Roberta have in mind? And Roberta said, I'm going to give you a shampoo. Now, it turns out that Roberta actually, prior to being a nurse, was a hairdresser. And so she went in a back room and shampooed this ALS patient's hair. And as they were leaving, I saw them with big smiles, both the patient and the husband. So the moral of the story is, yes, we're all looking for what's new in ALS therapy, but there are spiritual interactions that one could do as a caregiver, as a spouse, as a friend, and those were meaningful in the past, and they're still very meaningful. And if we don't pay attention to those, we probably don't have the holistic, comprehensive treatment of ALS patients we need.